Thank you, everybody, for having me here. I'm really excited to be presenting today at Praxis. And I'd like to start off with acknowledgement to country. I acknowledge the Darul and Yamingba peoples who are traditional custodians of the land on which I work and where we are today. I pay respect to Aboriginal elders, past, present, and emerging, and I acknowledge their continued spiritual and cultural connection to country. Always was, always will be. So, vagus nerve and whiplash. It's a very misunderstood presentation clinically, and it's, I would say, almost always missed. Now, before I get into the crux of it all, we need to know what the vagus nerve is. So the vagus nerve is the 10th cranial nerve, and it's actually the nerve which links our brain, particularly our brainstem, to the majority of our organs. So the vagus nerve is 80 to 90% sensory, and it's a neuromodulator. So what it's doing is it's collecting information, perceiving information, and the sort of information it's collecting is things like how much stomach acid do we have? What's our inflammatory regulation like? It's regulating things like histamine, mast cells. And an interesting thing about the vagus nerve is that it predominantly is our parasympathetic nervous system. So you've got two things in the body. You've got something called your sympathetic nervous system, which is fight and flight, and you've got your parasympathetic nervous system, which is rest, digest, recover, and heal. Now, you can't be in both states at the same time. So you're either in a sympathetic state, you're stressing out, or you're in a parasympathetic state and you're chilling out. So basically, what that means is stress, or the sympathetic nervous system, inhibits the vagus nerve. Now, research found that 3 weeks or more of stress, something occurs in the body called gene transcription, and it starts inserting what's called inhibitory receptors along the vagus nerve. So 3 weeks of stress, and that vagus nerve is being primed to be inhibited. So that means that when we're not in a stressful environment, we're still having trouble, or the vagus nerve is not able to pull us back into parasympathetic. So we're stuck in that sympathetic state. As you can see there, the vagus nerve, that yellow thing, it's a very interconnected thing. And the word vagus actually comes from the Latin word for wandering. And it's because obviously it's wandering throughout the body. So you've got two vagus nerves. You've got the left vagus nerve and you've got a right vagus nerve. And predominantly we see more gastrointestinal issues with left vagus nerve issues, and more irregular heart rhythm, mental health associated stuff with the right side of the vagus nerve problem. So I think the most important thing about the vagus nerve is actually its anatomy, and I'll go back a bit. So its anatomy, obviously it's external to the spine. It's coming anterior to our vertebrae in our neck, and it's then continuing down. It's supplying, our lungs. It's responsible for, biodiversity. It's actually responsible for biodiversity of all microbiome. They found in research that vagus nerve stimulation resulted in a change of all the biome. So biome on the surface of the skin, biome in the vagina, biome in the gut. And this happened after 10 minutes of stimulation. So there's a direct correlation of vagus nerve biome axis there. So now you've got a bit of an idea of what the vagus nerve is. Let's try and work out what happened. So what's it doing? It's regulating our inflammation. It's controlling heart rate and the rhythm, stomach acid and digestive enzyme regulation. It's responsible for peristalsis. So when we've got a byproduct in our intestines, it's responsible for that one directional synchronized smooth muscle movement. It facilitates frontal lobe activity. Now, it's doing this by spiking noradrenaline in the frontal lobe. So what's really interesting about the frontal lobe is its roles. So predominantly things that the frontal lobe do are things like divergent thinking, intellect, working memory. It's regulating our emotions, so emotional regulation, but also interestingly enough, is it's involved in learning from previous mistakes. So and stress response. So it really is the emergency brake to your stress response. Now, Whiplash. So whiplash involves some sort of impact or some sort of rapid change of movement where the head, the neck is thrown into, extension. And as you can see here, that's quite an aggressive movement in the neck. And then it can also be correlated to some flexion there as well. And what we need to consider is that what happens in this mechanism is that our vagus nerve gets tractioned. Now, not all people with whiplash injury have a vagus nerve problem, but the people who do have sustained a vagus nerve problem after that have an array of symptoms that medicine has not got any answers for. And predominantly these people are getting referred to psychology to talk about how their inflammatory regulations in their head and how their constipation is a psychosomatic problem. And unfortunately, it's not. The ligaments get stretched in this mechanism. So what's interesting is that the position of your head on your neck is dependent on stability and also endurance. So in not only the mechanism of the tractioning of the vagus nerve, but as a byproduct, causing the instability in the cervical spine, these ligaments get stretched. So what the body needs to do is adopt some sort of stability compensatory thing, and it usually puts the head forward. So you adopt like a head forward posture and locking your vertebrae into extension, and that's how it maintains stability. However, in this adaptation, what you've got is you've got an anterior translation of the cervical vertebrae where the vagus nerve is sitting, and you're getting compression there. Now it's measurable, and this is why a lot of stuff gets misdiagnosed and it's misunderstood. The tests, just people don't know about them. And there's only a handful of us vagus nerve clinicians in the country. So what happens? Yeah, we've got the protective guarding of the muscles, and we've got vagus nerve compression. As you can see here, this is the vagus nerve. I've taken a slice of the skin out just to represent sort of that central one. And if you can just see behind to the right of that nerve, you've got the first cervical vertebrae, and that's the transverse process, which is, it's got quite a large transverse process, is these bony wings on the side of the vertebrae. It's quite large in C1. So if there is some sort of forward movement of the C1 or even a rotation, I'll find these patients will have a rotated vertebrae where it's trying to lock to find stability. We're going to get neural compression. So we've got the forward head posture, we've got rotated and locked segments. Now this is really talking about cervicogenic vagiopathy, which is what I'm talking about today, which is a word that, again, no one's heard of it before, unless you're maybe in the United States and Florida. There's a bit more of an awareness there. But this is the vagus nerve here. This is with a mild forward head posture. And as you can see, there's that compression. Now compression doesn't have to be major compression. It can be low-grade compression, but over a long period of time. And what you're getting is an inflammatory response where the body goes, okay, this is enough. So these are some other positions that can affect it. So military neck. So sometimes people after this whiplash injury, they've got a high neck like that. It's just a compensatory thing. We're tractioning the nerve there. And symptoms of vagus nerve dysfunction. So these are not symptoms post-whiplash, or if they are symptoms post-whiplash, they're actually attributed to the vagus nerve and maybe have been misunderstood and carried to, oh, that's a normal symptom of whiplash. So we've got tachycardia, so that's a high resting heart rate. Now this is because the vagus nerve is regulating our speed of our heart. It's also regulating the rhythm in which it beats. So if you've got a regular heart rhythm, the vagus nerve should be, again, it's 80 to 90% sensory. It's measuring this. So other symptoms like POTS, that's postural orthostatic tachycardia, and that's sort of, that's what that is when people go from sitting to standing, they're getting bouts of dizziness or what seems like vertigo, and the sort of criteria for that is a heart rate of 30 or above upon the change of position, and it may remain elevated for 15 minutes. So it's really uncomfortable for the person. We've got constipation. And now, so this is low tone. There's a few issues with vagus nerve, and I'll go on to the next one, which is something that not many people have heard about. But in regards to low tone, means the vagus nerve is not working well at all. Its main function of the vagus nerve actually is toxin elimination. So when it's working better, if you've got toxins in you, it's going to be giving you diarrhea, it's going to be getting the toxins out. Now, an issue with that is obviously it's not working. Constipation, brain fog. So brain fog is neuroinflammation. That's brain inflammation. That's attributed to the poor inflammatory regulation that's as a result of the vagus nerve being affected. We've got gut dysbiosis. I mentioned before about the microbiome. Excessive sweating. This is when you're in a sympathetic response. So people sweating, and it could even be called hyperhidrosis, which is, you put a shirt, they're sweating all the time. Anxiety, poor inflammatory regulation, persistent cough, and it's because the vagus nerve is actually supplying endothelial lining in our esophagus. So we're getting this perception of like something's in our throat, and a lot of these patients will report that. Now, this is after this. I've kept this for just symptoms of vagus nerve after whiplash related to cervical origin. So there's a lot more symptoms, but these are symptoms that people are reporting after whiplash that can't be explained, unfortunately. And I've got a few case studies. So then we're talking about excessive tone. Now, how do you get excessive tone? Well, if you think of something think of a chronic pain picture where a nerve might be overly sensitized, where it needs less stimulus for something to be painful, you can actually get this in the vagus nerve as well. And it comes from mechanical irritation through the neck, where maybe the vagus nerve, it already has to bowstring around the lordotic curve of the cervical spine. But if this is excessive, again, we've got that head forward posture, then with movement, we're getting this vagus nerve rubbing along the vertebrae, and it's getting sensitized. And what that means is you're getting stimulation incidentally, and you get excessive vagal tone. And what that looks like is like bradycardia. You have extremely low heart rate. We're talking like 40 to 50 beats a minute. Orthostatic hypotension, we're getting low blood pressure, which changes of position because we're not getting an increase in the heart rate when we stand up. So there's a pressure gradient issue there causing the orthostatic hypotension. Diarrhea, because it constantly thinks it's trying to eliminate toxins. And also a lot of my patients with excessive vagal tone, although it's not as common as low tone, they sit down and they fall asleep. It's like a constant problem. They sit down in meetings, they're asleep. Frequent infections, because there's an inadequate or no real inflammatory response to these things that are getting into cuts and stuff. So they're getting these frequent infections, could even be frequent UTIs I've found. Fainting, vasovagal, we probably know about that. Inadequate sympathetic response. So something stressful happens and you really should elicit a sympathetic response to get away or do something, and and unfortunately that can affect people when they need it. All right, so positive signs of a vagus nerve problem. So taking someone's heart rate with a pulse oximeter and a push on their head, and their heart rate drops by 15 beats or more within seconds of me administering that. So maybe their resting heart rate's 95. I push on their head and I stabilize their neck. It kind of takes a bit of pressure off that nerve. And then the heart rate goes like 95, 92, 88, 84, 80, 74. Now, before your eyes, it's very rapid, maybe a 6-second delay. Tenderness on palpation. Reduced uvular elevation, but also can deviate. It's a bit dim, but what's happening there is the left side of the palate is higher than the right, and that's when we're doing a uvular sort of examination where you get the tongue depressed and you go, ah, and it lifts up. Should be lifting up, should be staying up. It shouldn't be going, ah, and dropping down. Or again, you can get deviations, and that's indicative of either a left or a right side problem. It will deviate to the stronger side because the vagus nerve is responsible for uvular elevation and the palate muscles. So another thing I can use to sort of pick up where this vagus nerve is compressed is, again, I'm using a pulse oximeter. I'm using vibrotactile stimulation, which is this vibration device. On the physical vagus nerve, I'll start up high and there'll be no drop in heart rate in response to me doing the stimulation, which should happen because I'm actually bypassing the brainstem. So it should just do it. And then hoarseness in voice, again, after whiplash, they're really hoarse in their voice. And oh, doctor, I've had the whiplash. It's been 11 weeks now. Do I know my voice is like this? And doctor goes, oh, it's in your head. Improved visual clarity with vagus nerve stimulation. This relates more to mast cells. POT symptoms reduced when reducing and clenching the jaw. So, they get POTS, the heart rhythm, or they get dizzy when they stand up. They tense their jaw while seated. Stand up, and while holding that stability, they don't get symptoms. And that's because we're providing more stability after an instability problem. Improved allergy responses within minutes of vagus nerve stimulation. So, someone's quite itchy, they're coming with like an itch or even like congestion or visual clarity issues with the stimulation on a particular one that for deep brain regions relating to mast cells, and they go, I can see better. Crazy. Exacerbating factors. Let's just look at the vagus nerve here. As you can see, this is when the C1, C2 is locked into extension. It is really getting pushed on there. Prolonged, what exacerbates it? Prolonged stress, post-traumatic stress disorder, food poisoning. It's because the poisoning is getting absorbed through the enteric plexus, which belongs to the vagus nerve. We've got chemotherapy drugs and recreational drugs, things like MDMA and cocaine, demyelinate the vagus nerve, or demyelinate nerves in general, but also they're sympathetic drivers, which again, suppressing vagus nerve. Viral infection, shingles, glandular fever, connective tissue disorders, which is Ehlers-Danlos syndrome. So I'm getting patients coming in. Can you put your hands flat on the ground without bending your knees? Can you bend your thumb to your forearm? Like, do you consider yourself double jointed? And yeah, and they pull their skin, and not everyone has the skin one, but their skin's really stretchy. You think, neck instability associated with that connective tissue disorder. Vitamin deficiencies, obviously choline, B1, B6, B2, omega-3s, because they're involved in nerves. And omega-3 is very anti-inflammatory. So after the whiplash injury, where there might have been some sort of neurological impact, we don't have available nutrients there to repair that nerve. So it kind of puts them a bit at risk. Treatment, cervical strengthening. We want to strengthen the neck. We want to do vagus nerve mobilization. That's manual therapy to the direct nerve, trying to move it away from the vertebrae that it may be pushed on, but also if the vagus nerve has been pinned by, the sternocleidomastoid muscle or other muscles, we're just trying to free it up, break any little hair-like projections or adhesions that may have adapted just due to the nerve not having good mobility. Vagus nerve stimulation through the ears is the most effective way to treat the vagus nerve. It's because the auricular branch of the vagus nerve goes to the solitary nucleus in the brainstem, and this is goes to a variety of brain regions, really impactful for anxiety, depression, polycystic ovarian syndrome, where we've got hormone regulation as well. Shockwave therapy, I won't get too much into that. Home exercises, putting your face in a bowl of ice water, 20 seconds, bringing your head out, wiping your face, and you're ready. You do it again. The diver's reflex, first note in dolphins, is a reflex where when they breach the water and they re-enter the water, there's cold water pressure along their snout and face, which causes a reflex via their vagus nerve, which lowers their heart rate so they can conserve oxygen while they're underwater. We're also mammals. All mammals have a vagus nerve, but that's the reflex we're trying to elicit. And it's been used in, I would say, like advanced cardiology prescription. Questions?
Well done.
There's a lot of stuff to cover. Yeah.
Very thorough.
It's a lot
and
to it.
great PowerPoint slides too.
Oh, man, I threw that together in 30 minutes. So forgive me.
Yeah, thanks, Daniel. I've got a really simple question. I'm just curious. What's involved in vagus nerve manipulation? Is that like massage or does it include other?
A few different things. So when you're massaging a nerve, what's actually happening is you're improving blood supply to a nerve, but also in a nerve that's stagnant or hasn't had very good nerve mobility, you're decreasing the viscosity of the axoplasm within the nerve, which improves signaling transmission through that fluid. So it's just traveling through a honey-like substance, may not be as thick as honey, but you get the picture. They're slowed, they're delayed, they may be late to the party.
Oh.
Yeah.
A question
Yeah, quick one. I've got a few hands up.
Yeah,
Yeah.
are you going to distribute these presentations to all
Yes.
participants?
Recorded.
Mhm.
I'll send you the links to recordings when they're available.
Okay, okay. And your second slide is very interesting.
Which one's the second one?
Second slide, the connectivity, the nerves.
This one?
The second, this one also, the military and normal.
Oh,
Military normal mind.
yeah.
Why there, it is very narrow for the military.
Military?
Mm.
Yeah, it's basically
Extended.
it's
The
Wait.
poster.
the poster.
Uh,
Oh, yeah. Because
Posture in the military.
yeah, you mean like
Very
it's not a very thick
Oh.
diagram?
yeah.
Yeah, it's because I just wanted to have the words bigger.
And your second slide, if you can share with me, we can go some paper.
Yeah. No, I am interested in doing vagus nerve research. So is my my previous lecturer who actually wrote the vagus nerve curriculum clinicians course in Australia. And yeah, I know he's very passionate about it. We haven't published any research on it yet.
One more question here.
Yeah.
Yeah, thank you. That was really, really interesting. I was just wondering, you said COVID-19. What's the mechanism by which that affects the vagus nerve?
Well, for a start, we're talking about long COVID. We're talking about a vagus nerve problem. That's what long COVID is. And that has been published. So it's the mechanism of viral infections attaching to nerves. So the like shingles, glandular fever, the viruses that really affect nerves and can sort of lay dormant in nerves. COVID is one of those things. And I would say it's to do with, or not I'd say it's to do with, but it'll be in regards to the nerves can get exhausted. So if the function of the vagus nerve is toxin elimination and an immune response, and it's constantly trying to elicit this response, it can get tired. Now, vagus nerve problems don't actually occur, I find, in isolation, like one event. It's usually there's a duo or a triad of like, I had food poisoning and then I got whiplash. Or it's my mother died and then what else could cause it? I got food poisoning. It's like a double whammy where it just can't deal with both of the things. And fortunately, stress is something that a lot of us are dealing with. So we've got this chronic low-grade stress, and if there is some sort of physical injury to the nerve, traction of the nerve, that's where it usually doesn't get through it, and we start to see these problems afterwards. Why I've done this presentation is because so many people with whiplash who have affected their vagus nerve, who do have these weird and wacky symptoms, no one that I know personally, and I do all the vagus nerve patients from New South Wales and Victoria to my knowledge, I fly down and do them, has been picked up. And I write doctor's letters for these people who are trying to get, maybe they're in a motor vehicle accident, had a paced motor vehicle accident, very clear vagus nerve problem. And, the doctor said, if you brought this letter into court, you'd be the laughing stock of the court. And and the lawyer, gets back, do the treatment, gets a hell of a lot better, on the day, lasting, very evident, but yeah, we won't get into that. Yeah.
So you mentioned like whiplash.
Whiplash, yeah.
So is it like something that happens when, like, let's say, like a car crash or something like that?
So today it was really meant to be about sport. So, in the sporting sense, maybe you're going up for, you're an AFL, you're catching a ball, someone gives you a shot in the air, you get that whiplash, head's thrown, there's a rapid traction. And if it's not the rapid traction, as I said before, it can actually be the adaptive position where then the head's forward, there's muscle guarding, and then that turns into vagus nerve compression, because initially, unless you're really pushing on the vagus nerve, it's not going to be a problem. It just takes a bit of time, or it needs a direct, like neuropraxia, sort of a tractioning of that nerve to cause it. Yeah.
So much. I think we have to finish up there.
That's all right.
Thank you.
Thank you very much.